This video will show you everything you need to know about how to fix weight training tendonitis pain. The information in this video can help with shoulder tendonitis treatment, wrist tendonitis, elbow tendonitis treatment, lower back pain, knee tendonitis treatment, and Achilles tendonitis. Here is what's covered in this video. 1. Does lifting weights cause tendonitis? 2. What are the root causes of weight training tendonitis? 3. Pros and cons of conventional tendonitis remedies. 4. A simple strategy to fix tendonitis, fast. It's called the TitaniumPhysique formula. And finally, how to treat and fix weight training tendonitis, in 3 simple steps. Let's get started. Does lifting weights cause tendonitis pain? One of the most common problem athletes who do weight training struggle with is tendonitis pain when lifting. It's frustrating, persistent, painful, and demotivating. It can limit your progress and muscle gains. If you experience tendonitis during your workouts, or burning pains in your joints after lifting weights, you are not alone. According to the National Center for Biotechnology information, tendonitis is a major medical problem in sport, due to increased participation in recreational sports. Tendon injuries are common with athletes, and those who do the same exercise activities repeatedly. So yes, lifting weights can cause tendonitis. 2. What are the root causes of weight training tendonitis pain? So, what causes tendonitis in athletes and weightlifters, and why does it happen? The 3 root causes of weightlifting tendonitis pain are chronic inflammation, muscle restriction, and joint subluxation. Root cause number 1, chronic inflammation. When we do any kind of weight training, it strengthens muscles, but it also inflames tendons, joints, and ligaments in the body. The inflammation of tendons produces the burning sensation of pain in the shoulder, elbow, wrist, knee or feet. The burning feeling in the tendons is a sign of acute inflammation. With time, the body heals, and the tendonitis pain goes away. But, when the body is unable to recover, and the inflamed tendon and joint pain continue for more than 3 months, it becomes a chronic inflammatory condition. Chronic inflammation is a state where the inflammatory process that allows the body to heal is not working. Left untreated, it breaks down the body. Athletes, gym goers, and weightlifters with chronic inflammation experience elbow tendonitis and elbow pain when lifting weights. For example, elbow pain during bench press, elbow pain during pull-ups, and elbow pain during push-ups. Shoulder tendonitis and shoulder pain when lifting. For example, shoulder pain during bench press, wrist pain when lifting, knee pain when squatting, or knee pain after squats. Root cause number 2, muscle restriction. Muscle restriction occurs when muscle fibers are shortened and unable to release, and lengthen back to their normal state. A traumatic event like lifting a weight too heavy, or using bad weightlifting form can strain muscles and cause muscle injury. When this happens, the joints around the injured tissue becomes weaker. To support the joint, the muscles surrounding the joint shortens, tightens up and forms knots. The muscle gets restricted and becomes dysfunctional. Tight muscles pull and put tension on the tendons and joints. As a result, it inflames the tendons and creates inflammation in the body, which leads to more pain. Athletes and weightlifters, with restricted and dysfunctional muscles experience shoulder pain when lifting, wrist tendonitis and wrist pain when lifting, forearm pain when lifting, knee pain when squatting, and knee pain after squats or lunges, upper and mid-back pain when lifting, lower back pain when lifting, foot or heel pain during exercise. For example, Achilles tendonitis. Root cause number 3, joint subluxation. Restricted muscles pull tighter on the joints. Over time, this causes the joints to move out of their normal position. This condition is known as a subluxation, and it can affect the joints and nervous system in the body, leading to pain. The misaligned joints can stretch and choke the nerves, leading to sharp nerve pain in the body. Misaligned joints can lead to an irritating, clicking, or popping sound of the joints. For example, the patellar during leg extensions. Misaligned joints also inflame the tendons and ligaments, creating excessive inflammation that leads to more tendonitis pain. Athletes with subluxation experience lower back pain when lifting, shoulder pain when lifting, knee tendonitis. For example, knee pain when squatting, and knee pain after squats, wrist pain when lifting, clicking and popping of knee joint during leg exercises, and clicking or popping of shoulder AC joint when lifting. For example, during shoulder press or lateral raises. 3. Conventional remedies for tendonitis pain. Are conventional remedies the best treatments for weight training tendonitis? As someone who struggled with chronic tendonitis pain, from lifting weights, I've tried the usual conventional treatments during my search to fix this problem. Conventional treatments are common remedies used to treat tendonitis pain. Here are 10 commonly used treatments for tendonitis. Number 1. Joint supplements and vitamins. MSM, chondroitin, fish oil, and turmeric. The cartilage of joints contains MSM and chondroitin. It's generally believed these supplements help ease pain in the joints and promote good joint health. Number 2. The RICE method: rest, ice, compress and elevate. Weightlifters with acute tendonitis experience a burning sensation of pain in the affected joint after lifting. Applying ice on the joint after working out reduce inflammation and help the inflamed tendon heal. Number 3. Nonsteroidal anti-inflammatory drugs or painkillers. Nonsteroidal anti-inflammatory drugs help reduce acute inflammation in the body. By reducing inflammation, NSAIDs temporarily reduce pain in the body and joints. Number 4. Cortisone joint injection shot. A cortisone shot, also known as a joint injection, is a steroid medication injected into the problem joint. It can provide temporary pain relief. Number 5. Physical and strength therapy. Strength therapy is often required to heal injured tendons and regain full muscle and joint strength for maximum athletic performance. Number 6. Joint support braces, sleeves and straps. Joint support sleeves temporarily help by putting compression on the tendon and joint. As a result, it reduces weightlifting pain in the joints during exercise. Number 7. Topical pain relief remedies. These include pain relief oils, creams, sprays and gels. Most topical tendonitis treatments contain MSM or anti-inflammatory medications that help treat acute inflammatory pain. Number 8. Sports tape and kinesiology therapy. Athletes commonly use sports tape and KT tape to treat tendonitis. They provide support for injured muscles and tendons. Number 9. Medicated pain relief patch. Medicated patches contain nonsteroidal anti-inflammatory medication and are applied directly to the pain area. For example, the lower back to relieve pain. Number 10. Stretching. A stretching technique like kinetic chain stretching can elongate the connective fascia sheet of a muscle group. In doing so, it helps reduce tension on the tendons within that muscle group. If you experience tendonitis pain when lifting weights, you've probably tried some of these remedies. Do conventional remedies work for weight training tendonitis? Conventional remedies only treat acute symptoms of tendonitis, not the root cause. It is why that tendonitis pain never actually heals and comes back. To get rid of tendonitis pain, you need to treat and fix the root cause of the pain. That's what I did. I treated and healed the root cause of my weight training tendonitis using the TitaniumPhysique formula. 4. A simple strategy to eliminate tendonitis pain when lifting weights. The TitaniumPhysique formula for tendonitis treatment. What is it? And how can it help fix tendonitis? The TitaniumPhysique formula is a unique and natural method that can quickly treat, fix, and eliminate chronic weight training tendonitis and muscle injuries. Additionally, it helps prevent tendonitis from developing or coming back. The TitaniumPhysique formula was created for athletes and anyone involved in weight training. It is based on extensive scientific research relating to tendonitis pain, sports injury, weightlifting injuries, musculoskeletal pain treatment and management, nutrition, supplementation, and strength therapy. It's a simple and easy to follow strategy to treat and heal chronic weight training injuries, including shoulder pain and elbow pain, forearm pain and wrist pain, stiff neck, upper back pain, and lower back pain, knee pain, and foot and heel pain. Here is the TitaniumPhysique 3-step formula. Step number 1. Plug the hole to get better. This step resets and repairs the inflammatory process in the body to get better. The inflammatory process controls the body's ability to fight and relieve pain. When the body is in a chronic inflammatory state, everything will be in pain. This step alone can neutralize and stop tendonitis joint pain fast. Step number 2. Go alkaline to perform better. According to scientific research on nutrition and sport supplementation, high-protein foods and sports supplements create acidity in the body. An acidic body can lead to joint pain. Becoming alkaline means making sure the pH level of the body is optimal and not acidic. When your body is alkaline, you will have more energy and less joint pain. Going alkaline also helps speed up post-workout recovery by boosting blood circulation and nutrients, and reducing acute inflammation of the muscles, tendons, and joints. If you experience tendonitis pain when lifting, this step will help. Step number 3. Release to feel better. This step involves self-myofascial release and joint mobility exercises to stimulate repair, neutralize pain, and strengthen problematic joints. If you experience tendonitis pain when lifting, this step will release restricted muscles and strengthen the joints to eliminate pain. 5. How to treat and fix tendonitis pain, in 3 simple steps. Let's go over the fastest way to treat and fix tendonitis pain, using the TitaniumPhysique 3-step formula. Step number 1. Fix chronic inflammation to get better. The food you eat is critical in getting rid of inflammatory pain. It is either going to cause and aggravate inflammation in the body, or fight pain and provide relief. According to scientific studies and research on nutrition, animal foods and animal products aggravate inflammation in the gastrointestinal tract. Combined with the stress frequent and prolonged weight training creates on the tendons and joints, the body unavoidably gets into a chronic inflammatory state. This systemic cycle of inflammatory foods and physical fitness is the number one reason most athletes and gymgoers experience chronic tendonitis and joint pain after a few months of lifting weights. Joint supplements cannot fix chronic inflammation caused by weight training because it is a systemic problem. If you feel like your body needs a reset, you can use a simple 2-week whole food plant-based regimen to reset and eliminate chronic inflammation. This does not require becoming a vegan, if that's not your goal. It is simply a tool to reset, and anyone can do it. The second step in fixing chronic inflammation is magnesium therapy. Magnesium is a potent anti-inflammatory that can help reduce pain. It also plays a vital role in helping muscles relax. Calcium helps muscles contract, and magnesium helps muscles relax. When the body has excess calcium, often the case, muscles remain in tension. Twitching muscles, muscle cramps and muscle spasms are signs of low magnesium levels in the body. Magnesium also dissolves calcium and prevents calcification of soft tissues like tendons. Calcification occurs when there is excess calcium in the body. Calcification hardens soft tissues, which can lead to tendonitis and joint pain. Heavy exercise, sauna therapy, and workout stimulants deplete magnesium in athletes. As such, it is crucial for athletes and those involved in weight training to actively take steps to replenish magnesium in the body, and use the right kind of magnesium to get the therapeutic effect. Step number 2. Go alkaline to perform better. Going alkaline is simple. Anyone can take steps to become more alkaline and less acidic. Here are 4 simple ways to alkaline to reduce inflammatory pain. Number 1. Wheatgrass and MSM powder. When you mix water, wheatgrass, and MSM powder, you get the perfect alkalizing drink. Number 2. Dark leafy green vegetable smoothie. Most vegetables, especially dark leafy greens, beets, and fruits are alkaline in nature. Number 3. Lemon water. The rich alkaline mineral content in lemons produces an alkalizing effect that exceeds the level of citric acid in lemons. Number 4. Apple cider vinegar. A mixture of apple cider vinegar, honey, and hot water produces an alkaline shift in the body when taken daily on an empty stomach. Step number 3. Release restricted muscles. Chronic muscle injuries and tendonitis cannot heal if the body is in a persistent chronic inflammatory state. After reducing inflammation and becoming more alkaline, we can eliminate muscle injuries and tendonitis faster by releasing restricted muscles. Restricted muscles pull tighter and put tension on the tendons and joints. Releasing tight muscles increases the elasticity of the muscle and tendon, and immediately reduces tendonitis pain. Chronically restricted muscles develop over many years. As such, it is vital to use the correct technique to release these tight muscles. It is also crucial to strengthen the joint of the muscles being released, by doing joint mobility exercises to avoid re-injury and regain full strength for maximum performance. Here is a summary of this video. Tendonitis is common in athletes and those engaged in weight training, who do the same activities repeatedly. The root cause of weight training tendonitis is chronic inflammation, muscle restriction and joint subluxation. Traditional tendonitis remedies like joint supplements, painkillers, joint support braces, patches, and sports tapes are not effective in treating chronic tendonitis. With conventional remedies, the tendonitis pain comes back and often gets worse. The TitaniumPhysique formula is a simple strategy to treat and fix weight training tendonitis. It can help you treat, heal, get rid of, and prevent shoulder tendonitis, elbow tendonitis, wrist tendonitis, knee tendonitis, Achilles tendonitis, and plantar fasciitis. Tendonitis pain can turn your passion for fitness into a chore and rob you of the motivation to work out. Yet, everyone who lifts weights experiences tendonitis pain at some point. Claim your passion and power back with TitaniumPhysique. If you would like to learn more about the TitaniumPhysique program and how to get started, check out the link below this video.